Welcome back to Eros Matters. This is Dr. Marta Tarali, and today we are diving into a topic that brings many people to my practice, vaginismus. Just last week, a client shared something that truly broke my heart. Everyone keeps telling me to just relax, she said through tears, as if I haven't been trying that for years. Before we begin, I'd like to thank our sponsor, Pink Lifestyle. Their thoughtfully curated selection of gentle products has supported many on their journey towards comfortable intimacy. So visit pinklifestyle.com to explore their range of body-safe lubricants, comfort aids, and progressive dilator sets. What is vaginismus? Before I go into it, think of how your eye automatically closes when something comes too close. It's a reflex, not a choice. So vaginismus works very similarly. It actually is the muscles around your vaginal entrance tightening involuntarily in anticipation of penetration, usually from fear of pain. So this can affect not just intimacy, but also medical examinations or even tampon use. Since 2009, I have been specializing in working with clients with vaginismus here in Singapore. So I've seen firsthand how this condition impacts not just physical intimacy, but also emotional well-being and the relationship. So what vaginismus is not? Let's debunk some harmful myths. I've heard far too many damaging myths about vaginismus over the years. Here are some of the most common and harmful misconceptions. Number 1, it's all in your head. No, vaginismus is a real physical response. So while the mental and emotional factors contribute, the physical reflex is beyond conscious control. If they know what to do, they would do it. Number 2, just relax and have a glass of wine. I often hear this from cynical people in the social media, and it's very, very harmful to those people who are actually going through it. If it was so simple, I wouldn't be running my 4th intake of professional certification for practitioners who want to work with clients with vaginismus. Healing requires a structured and supportive approach. Number 3, people with vaginismus aren't meant to have sex. So I cannot stress this enough. Healing is possible, and it is very probable with the right approach. So I work with hundreds of couples now who are now able to have pain-free, fulfilling intimacy just with some guidance. Number 4, you must have some kind of trauma, childhood trauma. While trauma can be a factor, not everyone with vaginismus has a history of trauma. Causes vary widely and can include anxiety, fear, cultural messages, lack of sexuality education, or sometimes no identifiable reason at all. Let's talk about vaginismus in Singapore, Asia, and beyond. Vaginismus is much more common than many people realize. There have been studies that say the prevalence rates range from 1 to 5% among fertile women worldwide. In Asia, including Singapore, conservative attitudes towards sex and limited sexuality education often mean that vaginismus goes undiagnosed or mismanaged. People simply did not come across this term vaginismus, so they do not know this is a condition that can be treated. A recent study by the Singapore Urological Study Group revealed that many local healthcare professionals lack the confidence to address sexual health concerns, underscoring the need for better training and awareness. So in my experience, many clients in Singapore, they struggle with feelings of isolation and shame. This is not something they feel they can talk to anyone about, including their closest friends or family members. These feelings are further amplified by cultural norms that discourage open discussion about sexual health. Think of it like taboo. It's critical to know you are really not alone. It's more common than you realize, and that help is available. So let's talk about the treatments and healing approach. So it's actually usually a multifaceted approach. It includes, number 1, education. So understand that vaginismus is not your fault, not something broken about you. Number 2, physical exercises. So learning how to control and relax your pelvic floor muscles through specific exercises and therapies. So I do teach this. And of course, there are other specialists who go even further about this, but I would be a good gateway for this understanding first. Number 3, gradual desensitization. So you can use small sex toys or progressive dilators, and you can combine it with relaxation techniques to gently retrain your body's reflexes. Number 4, emotional support. So working through any anxiety or fear around intimacy needs support. This might include counseling or therapeutic practices to build confidence and reduce stress. Use of appropriate tools. Many clients of mine do not know what to use, so I often recommend body-safe lubricants, gentle, small vibrators for external relaxation, stimulation, and also dilator kits if they feel inclined to. All of them are available at pinklifestyle.com. If you need certain selection, I can actually do these recommendations. So these tools combined with guided therapeutic exercises can make a tremendous difference. Since 2009, I have been dedicating my career to understanding and treating vaginismus. My work has been featured on leading platforms such as the Clearly Clinical podcast. It is a top resource for mental health professionals. And I'm currently going into my 4th intake of working with practitioners who want to specialize in vaginismus. So this goes to demonstrate my commitment in sharing knowledge and improving care standards, not just in Singapore, but beyond. My students are actually not in Singapore. My approach integrates clinical experience with a deep sense of empathy. What I teach is practical, down to earth, and completely possible. So I understand that those seeking help will find it very overwhelming, very scary. But I want you to know for every success that can happen, you need to take the first step. So just to share with you a success story. So a client of mine came to me after struggling with vaginismus for over 5 years and actually wrote this: Martha is akin to a miracle worker. I never thought I would be able to enjoy intimacy without pain, but now I finally can. You can actually look up the testimonials on my website, eroscoaching.com. So her journey, like many others, began with the courage to seek support and the right support to guide her through. Her story is a reminder that healing is not just a possibility, it is a reality that many have achieved. Now, the next step. If you have experienced vaginismus or pain during intimacy, know that you are not alone, and this is not something you just have to live with. I offer personalized programs and one-to-one guidance to support your journey. So visit eroscoaching.com to learn more about working together. Whether you are ready to start your journey or just want more questions or information, it's okay. I'm here to support you in whatever capacity. So here I have a reflection question. How might developing a new relationship with your body transform your experience of intimacy? So consider how stepping into a space of understanding and self-compassion can reshape your journey to pleasure and connection. And I'm not just talking about people with vaginismus. Thank you once again to Pink Lifestyle for supporting this episode. Visit Pink Lifestyle to explore their professional range of intimate wellness products designed to support your journey to pain-free intimacy. Now remember, you deserve pleasure, comfort, and confidence in your intimate life. Healing from vaginismus is not just possible, it is entirely within your reach.